Hello, my name's Kim Hodgson. I'm the chairman of vascular surgery at Southern Illinois University School of Medicine. When I was a general surgery resident in Albany, New York, I became interested in vascular surgery because of the complex nature of the treatments and the patients that that specialty involves. And I saw that the vascular surgeons were the ones that really could impact the quality of patients' lives mostly through limb salvage, and also save lives through treating the life-threatening conditions that we see in vascular surgery. There are other vascular surgeons in the region, but we often find that the more complicated cases are referred into us for the extra expertise that we have in an academic training program at SIU. You know, vascular disease is a wide spectrum of conditions. Some of them are life-threatening, some of them are limb-threatening, some of them are quality of life-threatening, like a stroke, for example. A stroke can be fatal, but more often than not, it's not fatal but terribly disabling, and those are the reasons why we try and prevent strokes, for example. One of the things about vascular disease that is depending upon where the disease is located, you may or may not have any symptoms until you have a bad problem, a really bad problem, such as a life-threatening problem if an abdominal aortic aneurysm ruptures, or a stroke if you have a carotid plaque that embolizes to the brain. And so in vascular disease, we treat some conditions that the patients know they have because they have a symptom and they have sought out medical advice because of that symptom. And we also treat disease which is what we call asymptomatic, which means it has not caused the symptoms that the patients are aware of, but we find out about it for some other reason. We detect something on physical examination, something is picked up on a CAT scan done for another reason, or a variety of incidental findings may lead us to evaluate a patient for a problem. Some of the conditions that we treat, we wouldn't treat until they became symptomatic. And so for those patients, we can reassure them that we'll follow them closely, and if and when time comes that something needs to be done, we'll be there for them to take care of it. There are other vascular conditions, however, that we should treat, even if they're not causing symptoms, because of the magnitude of symptoms and problems that they can cause when they become more active, such as an aneurysm that ruptures or a carotid plaque that leads to a stroke. So the variety of conditions we treat, some are symptomatic and the patients know about it and we alleviate their symptoms. Some are asymptomatic and the treatments we offer are prophylactic to prevent a bigger problem down the road. So historically, if you look at vascular surgery, the earliest operations to improve blood flow were bypasses, were surgical procedures to bypass around the blocked areas in the arteries. More recently, while we still do the surgical bypasses, and there's still a good number of patients that require surgical bypasses, many patients nowadays can be treated with catheter-based technologies, sometimes called endovascular therapy, where we use minimally invasive techniques, balloons and stents and other devices to open up their arteries to allow additional blood flow to their extremities or wherever it is we're trying to improve the blood flow. So that's been the most recent wave of technological advance that we've seen in vascular surgery, has been pretty much the downsizing or reducing the invasiveness of the techniques to, again, open the pipeline for blood flow. The new thing coming in the horizon, which I'm terribly excited about, is stem cell therapy, or gene therapy if you want, to actually grow new blood vessels. So instead of trying to bypass blocked ones or open up blocked ones with balloons, there's new therapies around that allow or offer great promise in growing new blood vessels for patients who have plugged up their pre-existing ones. So getting back to the issue of clinical trials, there are clinical trials for stem cell therapy going on right now, and we're involved in those trials here at SIU, and that again gives us a tremendous opportunity to save patients' limbs that otherwise would be lost because they may have otherwise unreconstructible vascular disease. So the thing that really distinguishes vascular surgeons who care for patients with vascular disease from other specialties like cardiology and radiology who can offer the catheter-based treatments is that vascular surgeons can offer all of the available treatments. Vascular surgeons can offer the medical management of patients to help control their cholesterol and blood pressure. Vascular surgeons can offer all of the less invasive catheter-based treatments to treat patients with vascular disease, and they can offer all of the surgical treatments for patients with vascular disease. And I think that that actually puts vascular surgeons in the ideal position to make the most objective decision about what's best for an individual patient. As an individual patient, I can look at them and I can say, well, I think I could balloon and stent this, but maybe you'd actually be better off with a bypass. If I were a radiologist or a cardiologist, all I could say was, well, I can balloon and stent this, but it may not actually be what's best for the patient in the long run. So vascular surgeons just have a much bigger tool chest than the other specialties do, and it puts us in a better position to care for the patients with vascular disease.